Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, what are the optic disc changes in the glaucoma? So, if you see the optic disc changes in the glaucoma, number one, okay, so actual changes are there is asymmetry of the cup is seen. That is the difference between the first both the cups. If you see right and left, the difference between the right optic disc, optic cup or optic disc and the left optic disc are asymmetric. They are not symmetrical. Then we have flame shaped hemorrhages are seen, especially in the sphincter hemorrhages are seen. These sphincter hemorrhages are mainly seen in neovascular glaucoma. Then we have nerve fiber layer will undergo damage or atrophy is seen, and we see that the cup to disc ratio, actually there is an optic disc and inside that there will be optic cup. This is optic cup, this is optic disc. So this optic cup to disc ratio is 0.7 to 0.9. So this is found to be increased to 0.7 to 0.9. You can also see thinning of the neuroretinal ring. So this area is actually the neuroretinal ring. Here you will see that the neuroretinal rim is thinned in in open angle glaucoma. Then there is double bending of the vessels are seen. That is, the vessels will bend like this. There is double bending of the vessels are seen in the there is bending here once and second time bending. Even here second time bending. In here there is double bending of the vessels are seen, which is called as bionetting sign. And these retinal vessels which are there, they become pulsatile in open angle glaucoma. We also see that there are pores in the lamina cribrosa. In the lamina cribrosa, you will see that there are pores are seen in the lamina cribrosa, which is called as lamellar dot sign. Laminar dot sign or lamellar dot sign are seen. Okay, so these are the optic uh, disc or optic nerve head changes in glaucoma. So if you see some pictures, the normal optic nerve head. So this is the normal optic nerve head in the glaucoma. This is the normal optic nerve head where the cup is smaller and disc is also, sorry, the cup is bigger and disc is smaller. Then we have this. What is this? This is actually glaucomatous cupping. See, now this cup is increased and disc is normal. So this cup disc ratio is increased in glaucomatous cupping. So this is the picture of glaucomatous cupping. Then we have nasal bending of blood vessels is seen in glaucoma. So if you see the blood vessels, if this is the nasal side and this is the temporal side, you can see that the blood vessels are bending here to this side. That is, nasal bending of blood vessels is seen in glaucoma. Then we have laminar dot sign is also seen. So if you see here, there is a sieve-like effect or holes are seen in the lamina. So this is laminar dot sign is seen. Similarly, we have presence of sphincter hemorrhages are seen. These are the sphincter hemorrhages which are seen in optic nerve head. Okay, so these are sphincter hemorrhages. So these are the different changes in glaucoma.
thank you and thank you for watching.